Concussions can be confusing and scary, but the good news is that we're here to simplify it for you. What's really happening during a concussion? How should you manage it? Is it safe to exercise, or should you just sit in a dark room? Let's explore all those questions and more so you can take control of your recovery. I'm Dr. Schwindt from MyoLab. Let's dive in. First question, what is a concussion? Well, a concussion is a type of mild traumatic brain injury caused by a sudden impact, jolt, or force to the head or body. This impact shakes the brain inside the skull, disrupting its normal function. Contrary to popular belief, you don't need to lose consciousness for it to be a concussion. Symptoms can include headaches, dizziness, confusion, and even changes in mood or sleep patterns. These result from the brain's inability to process information as it normally would. Next, what are the mechanisms behind a concussion? Well, when the brain experiences trauma, tiny chemical imbalances occur in the neural pathways, leading to an energy crisis due to a metabolic cascade. Essentially, the brain struggles to send and receive signals effectively, which explains why even minor tasks feel exhausting after a concussion. This energy crisis makes rest crucial, but as we'll discuss later, rest doesn't always mean isolating yourself in a dark room for days. How do you manage a concussion? Effective concussion management starts with 3 key steps: rest, gradual activity, and seeking professional care. So let's break it down. Step 1, rest. Rest the brain for 24 to 48 hours immediately after injury. Initial rest is crucial to allow your brain to stabilize. However, prolonged isolation can actually slow recovery, so balance is key. Step 2, gradual activity. After that 24 to 48 hours, start with light physical activity and mental activities. We're talking walking, gentle stretching, and even controlled screen time can be beneficial as long as they don't worsen your symptoms substantially. Step number 3, professional care. So recovery is not a one-size-fits-all. Working with a healthcare provider trained in concussion management ensures you're progressing safely and effectively. We need to determine if it's coming from the neck, inside the brain, inner ear, or somewhere else in the body. How about the classic question, should you sit in a dark room? Well, here's the truth. Sitting in a dark room all day isn't helpful for most people. While limiting overstimulation is important initially, gradually reintroducing light, sound, and normal activities helps rewire your brain and speed recovery. Can you imagine sitting in a dark room all day long? How's that going to help you recover? Can you exercise after a concussion? Yes, you can, and often you should exercise after a concussion, but it must be done in the right way. Studies show that light aerobic activity like walking or stationary cycling can improve recovery when monitored closely. In fact, in most cases, by week 2 after your concussion, it is absolutely critical to start light activity, even if you are experiencing noticeable symptoms still. But of course, be sure to get cleared by a trained healthcare professional prior. Pro tip, stay below the point where symptoms worsen more than 2 out of 10. Now work with your healthcare professional to determine your symptom threshold, which guides how much exercise is safe for you. Let's bust 3 of these myths about concussions. The first myth, you must lose consciousness for it to be a concussion. The truth, most concussions don't involve loss of consciousness. Myth number 2, you shouldn't use screens during recovery. The truth, screen time's okay in moderation if it doesn't worsen symptoms. Myth number 3, you're fine as long as symptoms disappear quickly. The truth, long-term monitoring is essential even if symptoms improve rapidly. Think about it as like the smoke to a fire. Now, concussion recovery tips. This is specific from Complete Concussion Management, a leading authority in this. Here are some additional recovery tips from that team. Hydration and nutrition. Well, proper hydration and nutrient-rich diet support brain recovery. Namely, reduce processed sugars and carbohydrates. Limiting the intake of high processed sugars and carbohydrates can help decrease neuronal inflammation in a concussion. Next, increase nutrient-dense foods. Talking about incorporating foods rich in omega-3 fatty acids and antioxidants, such as fish, walnuts, and a variety of fruits and vegetables to support brain health and reduce inflammation. Next, ensure proper hydration. Maintaining adequate hydration is crucial, as even mild dehydration can impair brain function. And consider intermittent fasting. Some evidence suggests that intermittent fasting may aid in reducing inflammation and promoting brain recovery. Avoid common food sensitivities. Identifying and avoiding foods that trigger sensitivities can help minimize additional stress on the body during recovery. Next, sleep hygiene. Consistent sleep patterns help your brain heal. Now avoid naps longer than 30 minutes while recovering. Lastly, vestibular rehab. If dizziness or balance issues persist, targeted exercises can help retrain your brain. Now at home, how can you test and monitor your own symptoms? Well, one simple way to monitor progress is through balance tests. Simply stand on one leg, kind of in a Captain Morgan position for 10 to 15 seconds. If this feels significantly harder than usual, it may indicate lingering symptoms. Now to wrap things up here, concussions are complex, but recovery doesn't have to be overwhelming. With proper rest, gradual activity, and professional care, most people make a full recovery. If you've recently experienced concussion or want to learn more about your symptoms, visit our website at myolab.ca to book an assessment. Thanks for watching, and we'll see you in the next one.